So I'd like to welcome everyone to this panel discussion on cannabis. A couple of things to start with. First of all, I'm Garrett Toy. I'm the town manager. And before we start the whole panel discussion, we did notice this meeting as a special council meeting. So with that, what I'd just like to do, and that was just so the council members could attend the meeting. So with that, I'd like the mayor to call the meeting to order. And then I'd like to recognize that that's Mayor Lax, and we have Vice Mayor Barbara Kohler, and then we have Councilmember Goddard and Councilmember Ackerman. I don't see John. Do you see John? I don't see John. Okay. So technically now our council meeting's in order, is called to order. In terms of Planning Commission, I don't believe I see a majority. So we don't need to call the Planning Commission to order, but if that changes, the chair will let us know and we can get started. So with that, I'd like to turn it over to Ben Berto. He's our Planning and Building Services Director, and he's going to moderate the panel discussion and also let you know how this evening's event's going to work and introduce all the panelists. Thanks.
Thank you, Garrett. Welcome again, and thank you for taking the time out of your busy lives to attend this discussion. This is going to be a live streaming webcast, so I'm also thanking those of you who are watching at home. On tonight's topic, the subject of cannabis is an important and rapidly evolving topic. Only a few years ago, possession of a small amount could theoretically land you in jail, and it's still listed, as we know, as a federal Schedule I controlled substance. And yet, today, we have 29 states who have legalized medical marijuana, and in November 2016, California joined 7 other states in legalizing adult use recreational marijuana via passage of Proposition 64. Locally, Fairfax residents voted by a more than 3/4 vote for legalization via Prop 64. Some people have called cannabis California's largest cash crop, and what we are seeing is the transformation from an underground economy to a mainstream business. We have presenters tonight that will discuss various ramifications in the post-Proposition 64 landscape and other state legislation with regard to cannabis. The newly formed State Bureau of Cannabis Control is in the process of issuing regulations. I think in mid-November they issued something like 400 pages. As of January 1, they will be issuing licenses in the various business categories. So what we see is efforts occurring at a state level to get this into a business context. Locally, Fairfax has a history of medical marijuana. In 1997, we were the first jurisdiction in the state to approve a dispensary under California's Compassionate Use Act. We'll be having remarks from Lynette Shaw, founder and still operator of a dispensary, at the end of the speakers' presentations. What the town is doing now is taking a deliberative approach towards looking at Proposition 64 and its regulatory landscape. In November, the town passed a 1-year moratorium on all commercial businesses except medical to provide residents and decision makers with an opportunity to thoroughly explore these issues. Those of you may be aware, if you're not, we are currently conducting an online survey, and we would encourage everybody who is a resident, or even those who may not be residents, to take that survey. You can be visited via a link on the town website homepage. What you will have before you in terms of the speakers is experts from a variety of topics. They have a broad range of professional cannabis-related experience and expertise. Their presentations are here to help inform Fairfax citizenry, policy advisors, and decision makers as we go forward. In terms of the format, each one of these speakers will have a discussion, and then, as I said, Lynette will have some brief remarks, and then we will open this up to questions from the public. As you came in, you were probably told that there are speaker cards and pens, and so to try to keep things organized, we have asked that people fill out the question cards, write your questions down, and we have staff here available who will take those cards and we'll look at them and then ask the speakers your questions and conclude the meeting that way. And without further ado, I'd like to turn this over to our first speaker. Daniel O'Leary has more than 15 years experience in economic development, working for local municipalities all over the state of California, including the city of Santa Rosa and currently the city of San Rafael. She has marketing and communications background, and most recently has been working in the cannabis regulation development scene. Danielle is now working with policymakers and industry leaders to review Santa Rafael's cannabis policies. She has worked extensively in the city of Santa Rosa, facilitating the council's medical cannabis subcommittee and internal city meetings to develop regulations and permit processes. Danielle.
Thank you. All right, good. Okay. I'm going to start with a PowerPoint, and my goal tonight is to break down Prop 64, the mechanics of it, not in a way that bores you, but just like kind of a flyover, and then kind of distill it down to local options for you to consider. So I'm going to pass the speaker intro slide because we already talked about that. I'll just touch on that my role for the city of Santa Rosa, fifth largest city in the Bay Area, was to manage their medical cannabis delivery process, the whole ordinance, basically from soup to nuts of everything that the city of Santa Rosa was going to do in the medical cannabis sphere. So from that came to Marin County, Proposition 64 passed, and started working with the city of San Rafael on their cannabis development. So this quote, even though the quotes are slightly off, the opportunity is missed by most people because it's dressed in overalls and looks like work. And I'm not going to lie, this is a lot of work, but I will say it's absolutely worth it. And as my tenure of being an economic development director, I have really enjoyed diving in and kind of understanding the nuances of regulation development and taxation. And cannabis really brings those two to the forefront for any community. So tonight's overview is just a breakdown of Proposition 64, the restrictions, the permitted activities, kind of the roles of the state agency, state taxes and revenue allocation. We hear a lot about cash crop and this 15% excise tax. Where does it go? What does it go for? And then local cannabis taxation. What are, at a local level, the regulatory costs that you would need to consider, and some tax strategies that you could look at going forward should you want to pursue that in your community, and kind of closing with some options. So the Proposition 64 vote, 56% yes, 43% no. Marin County was the third county, the highest county in the state, just barely under Santa Cruz, and of course San Francisco was number one. What changes is it legalizes adult non-medical use of cannabis, and it also creates a comprehensive regulatory structure for it. It became effective on November 9th, 2016, but really the commercial permitting of it isn't set to begin at the state level until January 1st, 2018. What about the locals? It does not change government's ability to place other taxes on medical and non-medical. So while it is permitted at the state, many people are surprised when at a local level they may or may not be able to access cannabis, because in the state, Western states specifically, local rule, local control rules, and so each individual city and county has the ability to craft ordinances and regulations that fit what they want to have happen in their community. So the restricted activities that you can see examples of what is not allowed under smoking, possession, growing, and giving away, consumption while driving a car in any public place other than a business license for on-site consumption, which would be that micro business license type available by the state, and anywhere where tobacco is prohibited. So a lot of cities are looking at their smoking ordinances as a way to manage consumption in public settings. Possession may not be possessed on grounds of a school, daycare center, or youth center where children are present. Growing, not allowed in an area that is unlocked or visible from a public place. And minors, providing cannabis to minors under the age of 21 for non-medical use is not allowed. Permitted activities, consumption, possession, and growing. What are examples of things that are allowed? Consuming in a private home or business that is licensed for on-site consumption, possession of up to 28.5 grams, about an ounce of cannabis, and up to 8 grams cannabis concentrate, and growing up to 6 cannabis plants for personal use. So let's talk a little bit about the state agency roles, because it's quite complex. The Department of Consumer Affairs is really the lead agency that houses the Bureau of Cannabis Control. And the Bureau of Cannabis Control is going to oversee a majority of the license types, specifically retailers, distributors, and testing. Okay. So the Department of Food and Ag will license and oversee cultivation, environmental compliance, and the track and trace program. The Department of Public Health will license and oversee manufacturing, ensuring consumers receive a safe product. Now, in the many iterations, this is just kind of a geeky thing, but testing actually was supposed to be under public health and then was relocated to the Bureau of Cannabis Control, which was once called the Bureau of Medical Cannabis. So you can see how things kind of change and have fluctuated. The controller allocates the revenue to be administered to the various state departments to do the regulation for the new law. And then the California Department of Tax and Fee Administration collects the tax. So now that we look at the taxation piece, state and local sales and use tax. State and local sales tax applies to recreational cannabis. Existing local taxes. Okay, so it does not impact existing local taxes imposed on medical cannabis products prior to Prop 64. So if you were a community that had a medical tax in place, the taxation still moves forward, but going forward now, medical cannabis is not supposed to be taxed with sales and use tax if you have a state-issued cannabis card. Now, if you have a doctor's recommendation, you would be paying tax. So these are nuances in the tax code that are still being worked out, but it's something that I wanted to mention. Future local taxes allow for the imposition of a local tax on medical and recreational cannabis products and activities. And there's the new state excise tax of 15% of retail price on recreational and medical cannabis. So you've got the sales and use tax, and then you have the excise tax, or a value-added tax, we could also call it. The state is also going to have a cultivation tax of $9.25 per ounce of dried flower and $2.75 per ounce of dried leaves. And the state tax on medical cannabis, as I stated here, is exempt only if you have a state-issued ID card. And recent data from the state shows that very few people actually take the time to get a state-issued card. Most of the medical cannabis patients are accessing medical cannabis through a doctor's recommendation process. So if you are in a community that has a dispensary, more than likely you're still going to be receiving sales tax unless there's that state-issued card. Sure. Sure. Okay. All right. Thanks. Sorry. All right. State revenue allocation. So out of that excise tax, the very first thing is the state is going to make sure that they cover their regulatory costs, what it costs to provide the enforcement. After that, that 15% excise tax is going to be broken down as followed. We're going to have the annual allocation, which is going to be under evaluations of studies and community services. There's going to be over $10 million through 2018 all the way till 2029. That's going to be evaluating the effects of Proposition 64. Then we're going to be looking at creating and adopting driving while impaired detection methods through basically 2018 to 2023, $3 million each year. Grants to provide community services for mental health and substance abuse treatment, job placement, and then studies on the risk and benefits of using cannabis for medicinal purposes. The remaining allocation, and unfortunately it's kind of hard to see in the slide, over 60% of the remaining excise tax will go to youth programs for education on prevention and treatment. The remaining 40%, 20% will be broken off for environmental damage and cleanup, really to encourage people to move off the black market in the cultivation sphere and get them into the regulated market. And then we're going to have the remaining 20% going to the CHP to work on the detection methods for impaired driving. So what are the potential costs of regulating and what revenues can be earned at a local level? I think this is a really important question that community members want to know. And here are some of the things that you kind of want to be thinking about as you develop your own process. There are permit and application fees. So as staff is developing a permit process and applications, there are fees associated with that. There's permit review and renewal fees. That's another area. Fees typically have to have a nexus to the cost for the city to provide that service. So there are some boundaries around that. Voter-approved excise taxes is another area that I think really for communities is something that is really important to consider. And this is basically a tax that's levied in your jurisdiction for the ability to be a cannabis business and in business. And you could look at it special versus general tax, and there's different things that are required. So if you have a special tax, that means you're dedicating it to a specific use, whether that's to fund police services or road repair or community parks. You put it out to your voters that it's going to be spent on a specific purpose, and it requires 2/3 vote from the public. If you go for a general tax, it requires 50 plus 1%, so a simple majority, and that can be spent by the city however they see fit within their general fund. So it provides more flexibility for the municipality. There are timing issues associated with each tax. So special taxes go on election cycles where you don't have council members running. General taxes can be placed on the ballot when you do have council member seats up. So that's just something to think about. There's also business license taxes and business regulatory fees. And regulatory fees are really like thinking about what is it going to cost as a town or city to make sure that the businesses are compliant, audits are done if needed, enforcement costs. Any of the costs associated with regulating the industry could be put in a business regulatory fee. So there's some tax strategies that you can think about. There's the gross receipts local tax, which is a percentage of gross receipts. Audits are going to be needed by your municipality to verify cash sales. You can do that internally, or you can actually contract those out depending on staff expertise. Gross receipts tax are impacted by price fluctuations, can be applied to all commercial cannabis businesses, are common for retailers and wholesalers, and provides information on business activities within their square footage. Square footage local tax can be applied to all cannabis businesses, not impacted by price fluctuation. It's less complex, will not represent volume of business activities, and it's easy to estimate future revenues. So if you're the finance director and you're trying to forecast, this might be a strategy you might be more attracted to from the ease of forecasting. But certainly gross receipts would take advantage of the fluctuation in market, and so you could potentially have more tax revenue some years than others. So local options. So if you're open to exploring cannabis in your community, what are some of the things that you could do or look to consider? You can look to adopt ordinances to regulate business license, local zoning and land use for cannabis businesses. You could consider limiting the number of licenses based on the concentration of operation in your jurisdiction. There's kind of two paths. One is a license that lies with the operator, and the other is the zoning and a land use entitlement that lies with the land. And I think that's an important distinction that every city and county will need to make. You can impose a tax on cannabis business activities, and you can enact reasonable regulation for personal cultivation. So the state was very clear that the personal 6 plants is a personal right as part of Proposition 64, but cities are able to regulate that aspect should it not be so expensive and cumbersome you can't do it, but if they want to be active in that space, they can. If you prefer to avoid dealing with any type of cannabis use in your community, you can prohibit cannabis by business and license type, and you can also prohibit the personal outdoor cultivation piece. So really what you are allowed is the 6 plants indoor or an accessory structure greenhouse. Now I understand Fairfax has its own cannabis rules and regulations, so that there might be a subtle difference. This is just kind of off the Proposition 64 framework. And with that, that will conclude my presentation. Thank you.
Thank you, Denise. Our next speaker, Beth Green, is a senior planner and secretary to the Cannabis Commission for the City of Berkeley. She has almost 20 years' experience working as an urban planner for communities in the East Bay. At the City of Berkeley, she's focused on policy issues, including zoning regulations and managing special projects. In 2011, she was appointed Secretary of Berkeley's Medical Cannabis Commission, and in that capacity, she has coordinated the development of Berkeley's cannabis regulations, first for medical cannabis-related retail and manufacturing, and currently is working on adult use recreational cannabis and commercial uses. And there's her PowerPoint. Thank you, Beth.
Thank you very much, and I'm very happy to be here. I'd like you to keep in mind that while I'm talking about Berkeley here, there are so many different ways that you can do this. So this is just an example of how one city chose to do certain things. I'm not going to go into everything Berkeley's done because we don't have that much time here. But I have been very involved with the development of Berkeley's regulations, and I'm happy to share that experience with you. So basically, I'm going to go over how Berkeley has addressed some issues related to cannabis in our city. Each city is going to have a different answer to this question based on their values, and that's what you really need to think about when you're coming up with your own regulations, or, know the different ways that things can be done, and then what are the ways that are going to make the most sense for Fairfax. Berkeley had a very strong direction from its community to allow medical cannabis businesses and now cannabis businesses in the city. Prop 64, I think, was approved by 83% of the citizens of Berkeley. So in our city, the question was never if we were going to have medical cannabis or cannabis businesses, but how are we going to do it, which is very different from what other cities are dealing with. So my focus today is just to go over some of the current regulations that we have right now in the city, and then touch on some of the experiences that are specific to Berkeley, such as our selection process, manufacturing, and unique regulations. So as you can see, 1979, I'm not sure if Berkeley was the first city to decriminalize cannabis, but we were definitely up there among the first. And since that time, we've had many ballot measures that have established a direction for dispensaries, cultivation, and manufacturing. So when staff was developing ordinances, we weren't starting from scratch. We were already being directed to allow this, and we just had to figure out how to do it. One of these measures did create our Cannabis Commission. It started off as the Medical Cannabis Commission. We've now changed the name to the Cannabis Commission. It has 9 members. Each one is appointed by a member of the council. And some of them are required to be in the industry, so that we do have people representing cultivators, collectives, and dispensaries. They are advisory to the council, and they are really supposed to recommend ordinances and regulations for the council to consider. And so basically at this time in Berkeley, we have 6 dispensaries which have been approved. So we had 3 that have been there probably since about 2004. 3 more were chosen in a selection process that I'll detail a little bit later. but those aren't active yet, so we still only have 3 in the city right now. We have 4 manufacturing businesses. We have 2 testing labs. I believe we also have an R&D lab, but that might be a testing lab as well. And then we have 7 residential collectives, and that's not really a commercial use. That is something that allows for patients to gather together and pool resources and grow together. So, but again, that's not a commercial use. And again, these are all medicinal in nature. So Berkeley is working right now to develop an adult use process. We are going to be issuing temporary licenses for the existing legally established businesses that you see up there, again, except the residential collectives, because they're not businesses. And so they will be able to sell adult use cannabis as soon as they get both the temporary license from the city and the temporary license from the state. And our timing to finalize our adult use ordinances is spring 2018. At least that's when we'll bring it to council. So I want to talk about a selection process that we use to select these 3 dispensaries. Initially, it was just going to be 1 dispensary, so we really had to have a selection process. And those processes are going to be necessary if your jurisdiction is either going to have a quota limit, so a numeric limitation on the number of businesses in your community, or if you want to have some other means of selecting businesses. So one thing that people are hearing a lot about these days is equity. So if there was some reason why you wanted to make sure that the businesses in your community had a certain characteristic, then you would need to have a selection process. So Berkeley's process had 4 rounds. They were all elimination rounds, and staff was responsible for ranking 3 of them. The 4th one, the 4th round then was the public process. So each dispensary had to go and have a meeting with the community in which they were proposing to locate in. Then they went to the Cannabis Commission and they ranked them, and then it finally went to council. And as part of this, the entity that was applying and their location were considered at the same time. So when they applied, they had to have a valid location that had approval of the property owner, which is important to keep in mind. And so would I recommend the process that we used? I'd recommend changing it. It was very complex for the applicants. In these 4 rounds, we had probably 10 to 15 different types of categories that people had to submit information for. Some were required and some were optional. But we had such a wide range of sophistication in our applicants that it was very difficult for many of these applicants to go through a process like that. Some applicants were very sophisticated. They'd run businesses either in the cannabis industry or other industries before. They knew what a business plan was. They knew what we were talking about when we said we needed a security plan and just a plan in general. Others had never obtained a business license. They really hadn't gone to City Hall before. And so it was very difficult. We got very different applications based on their sophistication, which then made it very complex for staff to compare them. And not only was it hard to compare, but with all these different categories that we had, many of them had few quantifiable standards. So it was very hard to do a ranking when you don't have a definitive thing that you're comparing something to. So it was complex for the applicants, complex for staff. We had some unnecessary requirements in there. One of them, the best example, was our competency test. We required everybody to sit in a room and we proctored it, and everybody had to take a test showing us that they knew our regulations, state regulations, they knew about cannabis. I would not recommend that. We linked the applicants to the site, as I said before, and this was done for a good reason. It was going to give the council the control over the location. It allows for the public to speak up about the location. It avoided a separate process for the applicant and the site, and so prevents situations where you might award an applicant something and then they couldn't find a site. And we also thought that it would be faster because you wouldn't have to go through two separate processes. It's just kind of a one-stop. But it ended up taking 18 months because our process was so complex. And that was very difficult for some of these businesses to hold on to a site for that long, paying the property owner some kind of fee for that entire time. So I would recommend a simpler process with simpler requirements. So you can still have a selection process, but I would provide very detailed descriptions about what is required for each category that you are going to recommend, and limit the categories that you're going to want to get feedback on. Just because you can ask for something doesn't mean that you should ask for something. Think about those things that are going to mean something to Fairfax and really give you an idea about this business and how it's going to operate. You also want to keep the state process in mind. The state didn't have any rules when we came up with our selection process. Now they do. So the state is doing a background check, and the state is going to have certain requirements. So you might be able to push some things off on the state and then just limit your process to things that are Fairfax specific. And then finally, equity. We didn't consider equity in this process. Equity can mean many things to many people. Some people think that equity, it's inequitable to have a process that requires you to hold on to a site for 18 months. So it can be based on income, being from a community that's been adversely impacted by the war on drugs. It could be, sponsoring local businesses to come in. But that's something that I think all cities right now are struggling with, if you do want to incorporate equity and what that should look like. Then very quickly, manufacturing. We have a manufacturer here today, so I'm going to let him go over what manufacturing is. But Berkeley basically treats manufacturing the way we treat any other manufacturing business. Doesn't matter if it's cannabis. We are agnostic to that. The only difference from a land use perspective that we have here is that they cannot have direct access to patients. All of the product has to be made on a wholesale basis, which is generally what you have in a manufacturing district anyway. But the reason that they can't sell retail is because then they'd be a dispensary, and so that's a different category. You sometimes hear about manufacturers using volatile solvents. Other businesses use volatile solvents as well. So we would just say if you're using that, you have to go through the same process as any other business that would use volatile solvents. And so I'm mentioning this here because for Berkeley, it's been a good experience so far. We haven't had complaints about these businesses. In fact, we really haven't had complaints generally about our cannabis businesses at all. These are generally small sites from our experience. And it's just an example of something where we didn't need too many regulations. We didn't overthink this one. We just said we treat it like anything else, and it hasn't been a problem. So an example of how just because it involves cannabis doesn't mean it needs to have a lot of regulations. So Berkeley, because it's Berkeley, has to have some unique regulations as well. Some of these are no longer as unique as they used to be. So Berkeley had testing criteria. I'm not sure if we're the only one that has testing at this point, but the state is now enacting testing. So once the state requirements come fully into effect in 2019, the idea that we have at this time is that our regulations will then go away, which is great because it's ridiculous for different jurisdictions to all have different testing standards for anything. In terms of medical cannabis for low-income patients, Berkeley was very concerned about, low-income patients and how are they going to access cannabis. This is not something that's covered by insurance in any way. So we require that dispensaries provide 2% of the cannabis that they sell annually to their low-income members for free. So that got a lot of attention You can imagine the jokes that came up about that one, but it seems to be working okay. And then finally, we require energy offsets for cultivation. So indoor cultivation is something that requires a lot of energy for the lighting and for the ventilation. We were estimating that one 30,000 square foot grow would have, for just the lighting of it, would have the same energy requirements as all of the streetlights in Berkeley. And that's if it was using LED lighting. If it was using incandescent lighting, it would be more like 4 to 6%, or 4 to 6 times. So, and Berkeley has a climate action plan. If we hadn't had some kind of energy offset for this, it would have blown our climate action plan out of the water. So for Berkeley, we had to do something about that. So we do require cultivators to use 100% green energy through a community choice aggregation program. So finally, lessons learned. And these are not just lessons for other communities. Since we're still working on our ordinances for adult use, we're looking at our lessons learned and trying to learn from those as well. So be careful what you ask for. You know, council got a lot of control in their selection process, but I'm not sure if it led to better businesses or if it was just a longer process than it needed to be. And then don't be afraid of new ideas. You know, just because it involves cannabis, maybe you don't need a bunch of rules. Think about what you want to see, what you really need to have in place. And consider what's important to your community. What are your values? And base some of your regulations on that. And with that, I'm done.
Thank you, Beth, for that very fine overview. I would also remind the audience that if you have questions from anything you've heard so far or anything that's occurred to you, we have people that can take your cards, or if you need a card and a pen, just raise your hand and let our staff know, and we can get those questions or take those from you. Our next speaker, Gary Fedoroff, is the director of Sunny Hills Restart Program. He also has worked at San Andreas High School in the alcohol and drug interventionist, as an interventionist, and he also has additional information to provide to us tonight. Thank you, Gary.
Thank you, I appreciate it. Should I just read my bio?
Sure.
No, I'm just kidding. Anyway, thanks for having me here, guys. It's this is one of my least favorite activities to do ever, especially since there's like a microphone and TV, but I'm also happy to do it, and I'm honored that you guys asked me to come here. I just want to start by saying I've worked in the treatment industry with adolescents primarily for probably the last 15 years. And what I'm here to sort of talk about, I do not have a fancy presentation, although I could pretend to click to make myself feel better. And these guys did a very, I'll just hold it for, they did a very wonderful job. But I'm really here as a youth advocate, more so than an expert in the effects of marijuana on our youth. I want to make it very clear because I know the crowd that I'm in. As a person in long-term recovery, I'm not here as anti-marijuana, I'm here as pro-youth. And so I just wanted to kind of put that out there because I'm not here to talk about how terrible it is. I just want to make sure that as part of this discussion, we're considering the impact that it's going to have on our kids and sort of factoring that in how we're going to handle it. Because medical marijuana is here and is, as well as recreational, and it's not going anywhere, and I know that, and so I just think it's really important that we consider the impact that it's going to have on the youth, and what are we as a community going to do to support that. So a little bit about myself. I have been in Marin County for the last, like I said, 15 years, and I've worked in treatment ever since I've moved here. I grew up in a little town called Willits, California. I don't know if anybody's heard of it. And the reason I bring, yes, we love you. The reason I bring that up is because growing up in that town, or I should say moving from San Francisco to Willits when I was in 6th grade had a big impact on me. And I think because, like Fairfax, Willits has the mentality a similar mentality around cannabis. And 25 years ago, before legalization or recreational use was here, this was the cultural norm in Mendocino, in Willits, was pro-cannabis. So that had an impact on me because of varying other circumstances that led me to experiment with that, which then took me down a road that I am now in and have been in recovery for many, many years. So I say that because I think, when I was listening to the presentations here, and I wrote this down because the restricted activities that she touched on, I sat there and I thought, wow, like I don't hear about stuff like that, because for me, the stuff that I hear about is really just wild, wild west, that, marijuana's legal, it's here, and let's all party. And when I was listening to that, I was like, God, both of these guys talked about all the regulations and restrictions around it, and I just found it very interesting because as somebody who works with youth in the community, that's not the message that I hear. The message is, hey, Gary, when I turn 18, I'm going to get a medical card and everything's going to be perfect. And so, it strikes me as interesting because we know everything is not perfect. And for youth, and I'm sure we're all familiar with these statistics, brain development, all that good stuff. But for me, dealing with these guys firsthand, I'm trying to treat the unmanageabilities. I'm trying to treat the lack of connection. I'm trying to help them put their lives back together. All the while, I'm trying to fight the fact that marijuana is here and it's recreationally, it's legal and all that. So Gary, it must be okay. So while many of us, and I see there's a couple people here who are on the front lines with me and have been for many years, we know that going up against this just adds another hurdle, which is really unfortunate because, like I said, I'm not anti-marijuana, I'm pro-youth. So one of the things that I want to bring up is, with alcohol and with cigarettes, we've learned many, many lessons. And I think that if you look at where we are with tobacco right now, it's very much stigmatized negatively. And if you look at the Healthy Kids survey from Southern Marin, and these are hopefully the only statistics that I'll throw out there, but 57% of 11th graders have reported to use marijuana in the last 30 days. And over Marin County wide, it's 49%. But if you look at tobacco, it's only 11% of 11th graders have reported to use cigarettes over the last month. And if I think about that, I think, wow, we're doing a really, really good job about educating people about the negative effects of tobacco and what that does. And those statistics tell me that it's working. So if we have a real opportunity here to not make the same mistakes twice. And I don't say that because I want to, I'm not saying that marijuana is going to be bad for you, but I just want to say that for youth, in my experience and what I see, it's not good. And so we don't want to make the same mistakes twice. So we have an opportunity right now, being at the forefront, bringing this into our community to be in control of the messaging from the very beginning so that we don't have to come back in and start to clean up this mess. As we've done with, if you look at the campaigns we have for underage alcohol abuse, if you look at the campaigns we have for cigarettes, we've been hitting them really hard and it's been working. So right now we have an opportunity to sort of do this with the recreational use and legalization of marijuana, bring it in our community, thinking about the youth and how it impacts them. I work at San Andreas currently. I'm also the director for a brand new substance use treatment center that's just down the road from us. And we have 10 beds, and I'll tell you that we're not short clients. And so, this being in our community, I just want you guys to be aware that there is a problem, it is here, and we all need to deal with it. And as an interventionist at San Andreas, what I see is these kids who are struggling, they come from Drake, they come from Redwood, they come from Tam. They're not being successful at traditional high schools. They come to San Andreas and they're more successful because they have more services. They have me, they have therapists, they have counselors, they have teachers, they're in smaller environments. And the common denominator for a lot of those guys is that they're engaging and experimenting in substances, primarily marijuana. So I think that the long of the short is, the short of the long, I don't know. Anyway, the moral of the story is that, you know, and I saw in one of the presentations that I was happy to see that there was quite a bit of money going to be set aside for youth, substance use prevention and treatment, which is great because we're going to need it. But I think, you know, for us, what we can do in this room is really be sort of pioneers in how we're going to market this and how we're going to, you know, the messaging that we're going to give to the kids. Because if we as parents say, hey, this is great, we should all be doing this, I look at my kids and they do everything that I do, good or bad. You know, and when they say a swear word, I can't get mad at them because they learned it from me, right? So having that amount of power is, you know, is something that I hope that nobody in here takes lightly. I don't think so. You guys all seem like a really good group of people that are just trying to do right by your community. And as somebody who deals with adolescents struggling on the daily, I just want to say, let's not forget about them. So I know that I don't think I talked 10 minutes.
You're about there.
Okay, good. Thank you. I appreciate it. So thank you guys for listening. It was awesome to be here.
Okay, our next speaker is Matt Willis. He's a Marin native and currently lives in San Anselmo. He's been the county's public health officer since 2013. He has experience as a physician, an epidemiologist, and a member of the community to guide public health strategy for Marin. He's a champion for innovative and highly collaborative approaches. He has co-founded the RX Safe Marin Coalition to address the opioid epidemic. He also served the U.S. Public Health Services as Director of Primary Care on the Navajo Reservation and at the Center for Disease Control in Atlanta, where he conducted research and outbreak investigation in the U.S. and abroad. Without further ado, Matt.
Thank you. Hi, everyone. It's great to be here tonight. I appreciate, Ben, you're framing this as a conversation where our understanding is evolving. And one of the ways that this is evolving is in our understanding of the potential health implications of cannabis legalization. And my voice tonight, I think, is to try and bring some better understanding of what are the potential health implications, because I think the best and best informed dialogue comes out of an understanding of what the intrinsic potential health implications are. So we're entering into conversations about policy and regulations, and we're learning a lot of the details there. One of the missing elements, as far as I'm concerned, is that those conversations are not yet grounded in a clear understanding of the science. And that's partly because cannabis, marijuana, has been a Schedule I drug. The DEA has deigned that this is a Schedule I agent, which has really harmed our ability to understand cannabis from a medical standpoint. Normally, if we were considering prescribing a medication as a physician, we would be, we would have access to information from the FDA that would say, this medicine at this dose has been tested in randomized controlled, placebo-controlled studies to have effect on this disease, and I'm going to write a prescription for this, and these are the known side effects. And we live in one of the only countries where there's direct-to-consumer marketing on television, and on those ads at the end, there's that long set of whispered disclaimers, right? So what are those for cannabis? Anybody have any idea? What would we say about cannabis at the end of our trailer in the promotion of the medical use of cannabis? Might cause euphoria, right? So I think we're good on the benefits, and I think there are many benefits. So there are, exactly, so I think there's some, so I think part of what I'm trying to bring is what can we actually sort out from the evidence we do have, given the fact that we haven't been able to study it the way we normally study other medications, to inform our conversation about both the benefits and the harms. I just turned myself off. Marin County's been ranked the healthiest state of county in the state for 7 out of 8 years, and I think it's partly because we're able to gather together and have these kinds of conversations and really have the dialogue we need to have, even when it's challenging dialogue. So that's, I think, part of the benefit of these kinds of conversations, and I hope they'll continue. The way I approach this as public health officer, I guess by way of context, the health department does touch cannabis structurally in a few ways. As the public health office, we manage the medical marijuana card system in our vital statistics team. So we do birth registration, death, and cannabis. So it's birth to death and one thing in between, which is cannabis. So that's in our shop. We also have the epidemiology team, where we do a lot of the measurement of the kind of across the population in terms of some of the threats to health. We look at incidents of different diseases as they come into the emergency room and that kind of thing. So there's opportunities there for us to help inform the consequences of more access to cannabis. We also have the substance use prevention team within the Department of Public Health, and we do a lot of work on opioids and other substance, alcohol. Our approach to opioids has been very much like I described in terms of our relationship to the pharmaceutical industry, which is to try and be healthy skeptics of what we're being told are the benefits. We know that the pharmaceutical industry has been very active in telling us all of the benefits of opioids. And partly as the result of the way in which opioids have been framed for us, we had an overabundance of opioids prescribed into the United States over the past 15 years. We're now dealing with an epidemic of addiction. I think we need to be also similarly careful in our understanding of cannabis if we're only listening to industry. So the way I approached this was to look at some of the major reports that have been generated from the National Academy of Sciences and the World Health Organization, who have basically taken what we can say about the health harms and benefits across all of the studies that have been done, recognizing that these are not the highest quality studies that I mentioned would be for other pharmaceutical products. These are observational studies. It's only through the randomized controlled process where you can actually establish causality. These are studies that can tell us about associations between things. So we're looking at populations. National Academy of Sciences published a study in 2017 with a goal to assess the health effects of potential therapeutic uses of cannabis, a comprehensive review of the literature, a year-long process of 10,000 articles or so published through August of 2016. So anything published after that was not considered. And then they stratified the evidence as being conclusive, substantial, moderate, limited, or no evidence at all. And I'm only going to offer you those things for which there was conclusive or substantial evidence, both for the things that were found to be beneficial and the things that were found to be potentially harmful. So benefits. So this is what they found for conclusive or substantial evidence of effectiveness in the treatment for chronic pain, for chemotherapy-induced nausea and vomiting, multiple sclerosis spasticity symptoms, and short-term airway dynamics. So cannabis can serve as a bronchodilator for people that have asthma short-term. And this is important in terms of the benefits for treatment of chronic pain. I, in my own practice as a primary care physician here in Marin, came with a bias against opioids as a safe and effective strategy for dealing with chronic pain for my own patients, and sought to find healthier ways for them to manage their pain. For my patients that were using cannabis to manage pain on the urine screens, if they ever had positive THC screens, that was normally totally acceptable to me as an adjunct to opioids, because I recognized for some of my patients it was actually an effective way for them to take fewer opioids. And there's now more and more evidence that cannabis, especially some of the cannabinoids, not the THC necessarily, which is the psychoactive component, but some of the cannabinoids, of which there are now more than 100 described, and we don't really know which cannabinoids are causing which benefit, partly because we can't study it in the way we'd like to, but it's clear that there are cannabinoids that attach to receptors in the brain that do effectively reduce pain. Other benefits of legalization, tremendous social benefits to legalization. In Colorado, the opioid-related deaths decreased 6% in 2 years following legalization of recreational cannabis. That's, again, observational data, but because of the evidence that it does help treat pain, it's reasonable to assume that that might be related to the fact that people were able to begin to wean off of opioids with more access to medical cannabis. In Colorado and Washington, post-legalization, there was also fewer arrests. There was decrease in violent crime, and obviously increase in tax revenue has been mentioned here. Another important social benefit of the legalization of marijuana is that incarcerations, arrests, and subsequent incarcerations for carrying cannabis is disproportionately applied to people of color across the United States. And our prisons are filled with, and jails are filled with people who wouldn't otherwise be having their lives negatively impacted forever from what should have been something that wouldn't lead them to be incarcerated in terms of just carrying cannabis. And that's, blacks and Hispanics especially have been really marginalized, partly because cannabis was illegal. So they're already seeing benefit for that in places where it's been made legal. So the harms and concerns, conclusive and substantial evidence, increased risk of motor vehicle accidents, increased risk of development of schizophrenia and other psychoses, lower birth weight babies with maternal use, and worse bronchitis symptoms with chronic use. So the most important of these, I think, is the accumulating evidence that early use, the second there, risk of development of schizophrenia and other psychosis, that the earlier people use cannabis in their life and the more they use cannabis, the higher the risk of the development of schizophrenia and other psychotic symptoms. And then the bronchitis symptoms, if that seems like a contradiction with what we're talking about in terms of respiratory symptoms, short-term benefit for bronchodilation for asthma, but if you're smoking it over years, it's more similar to the effect that cigarettes might have in terms of actually developing chronic obstructive pulmonary disease and other diseases associated with inhaling smoke into your lungs on a regular basis. Other findings that they found substantial evidence that some of the risk factors for development of problem cannabis use include male gender, cigarette smoking, again, initiation at an earlier age, and increases in frequency. So the earlier the onset and the more that young people use, the greater the risk of associated harms. But once people are in an unhealthy relationship with cannabis, they did not find that there was any difference between males and females in terms of their ability to wean off of the cannabis. Now, just to substantiate this, I'm going to go briefly through a different similar report, World Health Organization report from 2016 called The Health and Social Effects of Non-Medical Cannabis Use. The goals were to review the latest evidence and advise on health systems. So this is advice to medical providers around the world on how to deal with ever-increasing access and availability to cannabis. And I thought this might be sort of an offer, a less potentially, if people were concerned about a biased view from the U.S. National Academy of Sciences, that this was a global approach. And assessment of the available literature by an international committee focusing on young people on long-term use. So already focusing on what the potential concerns are really around young people. And they summarized their findings into short and long-term effects. And this is what their short-term effects, what they concluded was that this is sort of a no-brainer. Intoxication changes consciousness, cognition, perception, affect, and behavior. So they convened a gathering to describe what it means to be high, which is which we all know is part of the intended effect of consumption of THC, and then that it also acutely impairs driving, and there's an increased risk of traffic injuries. And then long-term effects, they found that regular cannabis users can develop dependence, that there's an association between cannabis use in adolescence and risk of developing psychosis and schizophrenia, and the symptoms of chronic and acute bronchitis, so those same respiratory symptoms. So taking those two together, if we want to hang our hat on sort of anything in terms of all of the evidence we have available to us now, my suggestion, having reviewed all this, is that we could operate on an assumption that these things are true or likely enough to be true to have our policies be consistent with this understanding that there's certainly benefit in chronic pain control, the social benefits I mentioned, and that the harms would include motor vehicle crashes, increased risk of psychosis or schizophrenia in early onset use and frequent use among young people, and that there are worsened respiratory effects with long-term smoking. Other cannabis-related concerns. In Washington and Colorado, they had an increase in 911 calls for cannabis unintentional intoxication among toddlers and pets. And then I'm just going to end with some of the statistics here from Marin County that relate to what Gary was talking about. These are the numbers of treatment admissions for addiction among 12 to 25-year-olds in Marin County. So these are people who are seeking treatment who need help, are asking for help for a problem with a substance. And the most common substance that is leading people to ask for help is marijuana among people aged 12 to 25. So whether or not we call this an addiction technically, or whether we call it a dependence, if we take a functional understanding of what that means in terms of someone's need for help because it's affecting their life in a negative way, we know that marijuana is actually a major problem in that way. Heroin is second, and then alcohol. And that's particularly an issue for young people, and this gets, I think, to what Gary was saying, and I think for me, as a public health officer, what I would hope we would find some consensus around is that our interests are really primarily around protecting young people. However we feel about recreational use, I really like that we're calling it adult use, because it is adult use. When we're talking about recreational marijuana, we're talking about adult use, and we need to really have our systems in place to make sure that what we actually mean adult use, and that we're not getting it to our kids. And this is just another piece of data, local data, that substantiates that, which is among our people aged 12 to 25, a much higher proportion of them who are seeking admission for marijuana among those young people compared to everyone else. So about 35%, more than a third of our young people aged 12 to 25 are seeking treatment for marijuana. A much lower proportion of people who need substance use treatment in Marin County who are adults need it for marijuana. It's heroin, alcohol, other things. I'm ending with this. These are the things we're going to be tracking moving forward, just because this is our knowledge is evolving. This is a giant social experiment as far as I'm concerned. And we want to be really tracking this diligently so that we can adapt our strategies as we learn. And we're going to be measuring some of the effects in terms of some of the health harms and some of the social benefits that we may see. And we'll be continuing to offer sort of updates to our communities based on what we're observing here, especially here in Marin in terms of some of the emergency room visits. And we'll be tracking treatment admissions among young people. Some of the things I presented here, we're going to be tracking those over time. And that's my last slide. Thank you.
Thank you. Our last speaker is Aaron Burke. He represents the industry as co-founder of Monk Provisions with Melanie McGraw. Monk produces all natural, botanically driven products with low doses of THC. Prior to co-founding Monk, Aaron served as the executive director of an award-winning vertically integrated dispensary, and together Aaron and Mel developed state-compliant operating models for dispensaries in Nevada, Arizona, Massachusetts, Illinois, and a number of other states. Together they have combined 15 years advising operators on how to ensure absolute compliance while prioritizing patient care and the patient experience. Aaron has also worked for a nonprofit organization focused on building small businesses to serve disadvantaged communities in partnership with the city of San Francisco. Aaron.
Thanks. Hi. So, as mentioned, Monk Provisions is a manufacturer. We make cannabis beverages, and before that, I spent years developing state-compliant operating models for different businesses, and so that includes dispensaries, manufacturing businesses, cultivation sites, and then previously I've done a lot of work with local government, and so I'm going to speak a little bit about the different products that are available today, things that we'll likely see become available in the adult use market, and then a little bit about the different permit types that we'll see and how that's likely to affect us here in Fairfax. So traditionally, flowers have been, they're about 90% of most sales. So people would buy flower and then smoke it. More and more, we're seeing flowers lose market share as vaping is becoming popular. And so vaporizing wasn't super popular when people needed tabletop size vaporizers, but now with the vape pens that are very similar to the tobacco vaporizers that you see around are getting a lot of market share. And that's helped a lot of people with coughs, but there's a lot of concern in some circles about how the oil in those vapes is produced. There's propylene glycol in a lot of those, when some folks believe that that's pretty bad for your lungs. So there's some questions there, but also potentially some benefits. So it makes a big difference when you're talking about where products come from, if you're going to actually try to understand the positive or negative effects. Edibles traditionally were a pretty small percentage of the market. Cookies and brownies were some of the big sellers. But because most businesses, most dispensaries in California, most collectives were operating based off of Prop 215, the collective model, dispensaries were purchasing their inventories from members of the collective. And so people would grow cannabis plants in their closets or basements. They would make edible cannabis products in their home kitchens oftentimes, and we would see them wrapped. Years ago, many of the edible cannabis manufacturers would come in with things wrapped in a plastic wrap or wrapped in aluminum foil, and so there were things that wouldn't pass any health department inspection. So more and more we're seeing that bar raise, and we're seeing companies like Monk. I mean, we look more like a craft brewer, where we have brew tanks and are filling glass bottles that are hermetically sealed and pasteurized and things like that. So more and more regulation is allowing people to invest more in doing things the right way and in the associated testing. So edibles, I think, will be a huge growing segment. I think we'll see more and more of that. There is still going to be, as we saw earlier, there are rules against smoking in public, and I think there is still a stigma attached to that. And I think that a lot of the edible products that are in the market today, like the gummy bears and the cookies and things, are things that appeal to children or to young folks in general. And I think those will start to go away. We've seen lawsuits in different states where manufacturers have had to pull products because people have taken over-the-counter candies that they've purchased and added THC to them. We've seen a lot of things like that in different states, and so that's not going to be permitted in California. Most other states where that was permitted, they've changed the laws to stop that. Topicals, we'll see a lot more sublinguals. Transdermal patches are becoming more and more popular, which allow for, it's sort of like a nicotine patch. It allows for a sustained release. And so people are wearing those sometimes for 12 hours or 24 hours. And so more and more we'll see products that are not, that haven't gotten much attention in dispensaries to date, partly because there's a development cost in there. But also partly because there's been an incredible price sensitivity in dispensaries. So And I think when you're also talking about, you also see a lot of capsules and, there are more and more suppositories that are coming out. And I think when we're looking at a lot of the benefits and there are a lot of claims, a lot of people who are treating cancer will say that cannabis has helped them, and oftentimes it's because of the medication. But a lot of folks are starting to look at the anti-angiogenic properties as well. But then you're looking at capsules and things that are not commonly sold at a lot of dispensaries. So the types of permits that we'll see, we've heard a little bit about them, but there'll essentially be two types of permits. Permits will have an A or an M attached to them in the state. And so M is for medicinal, A is for adult. So cultivation is, we may see people wanting to cultivate here in Fairfax. I think that's interesting, the question of cultivation, because generally when states adopt regulations, we see an influx of growers. And oftentimes those grows are huge. And then some states in Arizona, there's a group that has 1 million square feet of greenhouse space where they're growing cannabis. There are other groups that have hundreds of thousands of square feet. And so pretty quickly prices drop. And it's already started to happen in California over the last several years. 5 years ago, a lot of dispensaries would pay 2 times what they're paying today for the medicine that they sell. So I think if Fairfax was to permit cultivation, my guess is that they'd probably be smaller grows. I don't know, but the challenge for Fairfax, for a cultivator to locate in Fairfax, is they'd be competing with the statewide market. And a lot of big corporate money is coming into the industry and is investing a lot in growing. And so I think if since there will be that supply, if there's a cultivator here in Fairfax that doesn't have a whole lot of space, they won't benefit from economies of scale, and whatever they grow will likely have a higher cost to them. With manufacturing, as mentioned, there are volatile and non-volatile solvents that are used. There's a lot of fear around volatile solvents like butane for a long time. But a lot of that's because it was unregulated. And so we would hear about butane explosions in people's yards or in people's houses. But whether it's volatile or not volatile, it's a non-volatile extraction method would be to use CO2. But that's still under an incredible amount of pressure. And so the same danger to employees and surrounding neighborhood is there if regulations aren't followed. But there is a pretty strict regulatory framework that hopefully will prevent bad things like that from happening. So for manufacturing permits, there'll be permits for volatile manufacturing, non-volatile manufacturing, and then also for infusions. And so what we're starting to see is more and more manufacturers pop up around the state that are just doing the cannabis extraction. And then they're turning around and selling that to people that make cookies or other edible products. A lot of manufacturers, and more we're seeing this to be the case, are they're infusing cannabis. And so they're purchasing it from somebody who does the extraction. And a lot of these manufacturing businesses look more like a local bakery might. Often they need a commercial kitchen or something like that. So it's not, manufacturing sounds scary, it sounds industrial, but often it's a very small footprint and not a heavy tax. Distributors are required to move product from manufacturers to dispensaries, and so distributors they'll be responsible for collecting taxes and for a lot of the lab testing. I mentioned earlier that butane was often used. There are all sorts of solvents that are used in extracting. There are all sorts of chemicals that are used in growing, and fortunately, most of those there are huge testing requirements that are going to be that everybody's going to have to abide by starting Jan 1. Or should abide by during January 1. Inventory that's already in stores will sort of be grandfathered in, and so you might see stickers attached saying, if it's not been lab tested, On January 1, it has to have a sticker saying this has not been laboratory tested, and there's some additional warning language on those stickers. But everything will be tested. Everything will be tested for any residual solvents, for microbiological content, for potency. So the testing requirements are pretty involved. And then there's retail. And I think retail in Fairfax is, it's interesting because there's, in so many places it's a money game. As was mentioned earlier, if you can hold real estate for, 12 or 18 months, then you'll have a shot at the permit. And if you can't, then you can't really apply. And so more and more we're seeing cities start to separate those two things and say, well, we want to be able to evaluate people based on their qualifications. And then once we have people that we like, that we feel are trusted members of the community, that share our values, after we've approved that group, then we can move on to providing some sort of, to approving the property that they find. And it is true that the state is going to do a huge background check on all the applicants. Unfortunately, I think if local folks push all that responsibility onto the state, then you're going to get a situation where local folks will award permits to groups that they like, and then sometimes they'll fall out of the state process and they'll have to go back to the evaluation process to select. So some qualitative evaluation and background check is probably best at the local level, so that you don't have to go back after the state makes their determination. And I guess that's all I have. Yeah.
Okay. Thank you very much. Okay, we have a number of questions from the audience, and, oh, excuse me. Lynette, I'm sorry.
Good evening, everyone. I'm Lynette Shaw, and inventor of the licensed dispensary system right here in this room in 1997, which started a revolution that has gone across the nation. I'm very proud and honored to have been the birth mother of the licensed dispensary. And I'm happy to see you all working on this. It's a really big job. And I had no idea it would, I was hoping it would evolve to this point, and I'm very happy to see that it is, because marijuana has always been here. It's been here for thousands and thousands of years, and prohibition obviously did not work. And having regulations brings it into the light, and stepping into the light is also a very interesting thing to do. We had a secret testing lab previous to my closure, because we felt that it was very important to test our products even though it wasn't required. But we had to have a secret testing lab because it wasn't legal to test marijuana. But we still tested it. It was very important to have the cleanest, best products we could possibly get. I'm I'm a little overwhelmed emotionally right now, because this is really what I worked for so long, to have an open, honest dialogue about what we can do about cannabis. I'm a medical user. I must have it. And many of my people are very, very sick, and they must have it also. The new adult market is a whole other thing. That's, from what I'm being from inside the movement, 10% of the marijuana smokers are medical. We're looking at a 90% larger market of access, really and truly. Everybody's been smoking at home, in their closet, in their garage, and hiding it. So we're bringing that into the light also. 90% more people are now legal to use the marijuana they continually used now for a long time as adults. So now we're dealing with, reality. This is really where it's at. Prohibition didn't work. Education works. That's one thing that I was, appreciate about Gary here, is that you have to teach your children well. You cannot prohibit it. That makes it glamorous. You have to show them what the truth is. If someone's having a problem, you have to deal with it in an adult manner, because kids they're becoming older sooner now. And also, quite often, the teenagers, they grow out of it. And then they come back later on when they're very sick. They go, oh, yeah, I used that when I was a kid, but then I went to college. I was too busy. And now that I'm really sick with cancer, I want to revisit this whole issue. One good thing, all history has ever died from the use of cannabis, ever. So we're dealing with a substance that is much less harmful than tobacco and alcohol. So it deserves to be regulated. We deserve to not go to jail. And a benefit from Prop 64 that I'm very, very happy about is since November 9th, 4,500 prisoners, marijuana prisoners in California have been released under Prop 64. We've got a couple thousand more to go. But generally, the marijuana prisoners that were taken in for whatever reason, just marijuana, have been released thanks to the people voting in Prop 64. And that was my goal. There's a lot of regulations. It's going to be onerous, but I'm used to a lot of regulations. In fact, many of the regulations I've been functioning under for many years are more strict than the state standards. So I'm hoping we can maybe negotiate on some of this stuff too. But it was worth it. It was worth all the work. It was worth all the hassle. It was worth all the strict regulations, all the overviews, all the audits, and all the problems I had to go through because now we have the end result, marijuana peace. And that's what my goal was, marijuana peace, not war. Thank you very much.
Thank you, Lynette. Okay, I hope we don't run over. I'm going to start with the more prosaic questions, and then we have some that are a little bit more broad-reaching. But here's a quick question. What effects will there be on financial access, especially for low-income people, to cannabis products? Does anybody have any? I think, Beth, you related something about Berkeley's guaranteeing access for medical cannabis products for low-income people.
Right, so that's for patients. So obviously when we have businesses that no longer have to be collectives and have to have members, we're going to have to figure out how to assign that. But in general, I don't believe the state has a program for that.
So compassionate care, as is often referred to, has been popular in the industry for a long time, but under the new state regs, cannabis can no longer be given out for free to anybody by any permit holder, unless it is a medical patient. And so if somebody has a state card, a dispensary will be able to give them free medicine, but if they don't have it, if they're just an adult customer, the manufacturers, brands, stores, nobody can give out any free or, there's no free promos anymore.
For the cards, it's $100 for a card, and if someone has public insurance, it's half of that.
Okay, thank you. Question about production regulation. What exactly are the regulations on marijuana cultivation? Are pesticides allowed? Are there any tests done on smoking pesticides?
There's a list of things that most testing facilities will test for, and you asked if there's a list of what?
Just pesticides and well, first of all, yeah, in terms of pesticides, will people be allowed to use pesticides, and will that have any impact on smoking?
There are a number of pesticides that have been prohibited, or a number of ingredients in common pesticides that will not be allowed. So every batch will have to be laboratory tested, and if any of those things come up in a lab, then the product will have to be it can't be used.
Okay, thank you. I'm going to not ask the question about the cultivation since we don't have a cultivator here. For Ms. O'Leary, I was under the impression that there would be a difference in taxes between medical and recreational cannabis, and what are those, and how will that occur?
Sure. So the state excise tax or value-added tax for cannabis, the 15%, applies to both medical and adult use. It is in the sales tax designation that the taxation takes a different route. So if you have the state issue card, you are tax exempt. If you carry forward just with your regular medical doctor recommendation, you will be subject to sales tax. So that's at the state level, they've benchmarked a relatively low state rate of registered cannabis users, and going forward, they're going to see if that sales tax exemption is going to cause an increase, but that is the real kind of geeky taxation nuance for people to be aware of.
Thank you.
And people are doing different things. A lot of cities are allowing just medical to remain or to apply. Other cities are allowing adult use, and a lot of cities are allowing the same dispensary to serve adult use folks and the medical patients. And so that's really something that's determined at the local level. And there are different rules. Obviously, if you're a medical patient, you can be 18. If adult use is for people that are 21 and over. And so there are different rules around access to stores. But if, and some local folks are requiring, if there's an adult use business and a medical business in the same facility, that there are different entrances. But most local jurisdictions that I've seen around California are allowing them to happen at the same, in the same place, as long as that verification is done at the point of sale. It's a pretty easy thing to verify.
Thank you. This is somewhat of a rhetorical question, and which is, why not keep it out of our town until it is better regulated? And they mentioned the possibility or the likelihood of lawsuits. And I don't know if you could maybe address a rhetorical question about taking a wait-and-see position at this time.
There's one date that matters, I think, which is, as was alluded to, there are now emergency regulations put out by the state in terms of what will, on January 1, what actually will the law be. And it includes some of the things that are relevant for this conversation. One is like that the products cannot have any reference to candy or look like candy. They can't be attractive to children. That labels have to have a warning on them. There's a new warning that has like an exclamation point. It's a black and white warning. No food lookalikes, so can't be gummy bears. You know, there's this effort towards making the labeling very clear in terms of the THC content and relatively neutral in terms of its attractiveness, especially to children. The current market has a lot of things that don't actually comply with those laws now. So there's Captain Crunch-like products and that kind of thing. There's going to be a 6-month allowance for those to sort of that are currently in the supply chain to sort of wash out. So on July 1, we will begin with what the emergency regulations now determine to be safe labeling and packaging. And until that point, we will continue to have products for sale that may in fact actually be specifically attractive to children, et cetera.
And there are different regulations around if a dispensary has products in inventory as of Jan 1, they can continue to be sold, but there are additional requirements if they take those in after Jan 1. But they can be sold, there's a child-proof requirement, for example, a child-resistant packaging requirement. And so the state of California now, like a number of states have already done, have said that 10 milligrams is representative of 1 dose. And so there's going to be a new limit to how much can be in an edible product. It's going to be 100 milligrams in the adult use market. In the medical market, it's different, but in the adult use market, no product can have more than 100 milligrams in it. And today we're seeing a cookie with 200 milligrams or drinks with 200 milligrams. And so it is going to be quite a different thing that we see. But because the state has defined 1 dose as 10 milligrams, everything has to be in a child-proof, child-resistant packaging. Even if it's already in inventory, dispensaries will have to place it in there if it didn't come like that. And it has to be a resealable, child-resistant package if it has more than 1 dose, if it has more than 10 milligrams.
One more point. Just getting back to, should you take action or just kind of wait and see, look at what everyone else does? And just because we've had a lot of discussions about this, I'll kind of give some pros and cons here. I mean, the pro to waiting is, yeah, you see the mistakes that other people make, or you see good things that they did that you might want to incorporate. So that's always good. We were talking about this earlier. I mean, there are still changes coming down from the state, and I'm sure there will continue to be changes coming down from the state. So, you know, I could see why waiting might be attractive. The reason that some people or some jurisdictions are saying, let's move on with this, is if you do want to have these businesses in your community, if you wait too long, they're going to be established in other communities, and then you will kind of have missed the wave for that. So that's, again, has to do with your community. Each community has to make that decision for itself. But if that's something that's important to the community, then you do have to weigh that. I know that Colorado and I think Washington saw many, many businesses start up and then many failed. So, you know, it really depends on what you want to see, what's your long range for this in your community.
And I think in terms of lawsuits, I've not seen, you know, in a dozen or so states that I've worked in, I've not seen lawsuits from consumers. I have seen lawsuits from people who've applied for permits and not gotten them. And that's, you know, that could be mitigated a couple different ways. You know, if people are investing a tremendous amount of money to go after a permit and they lose, they might be more inclined to try to make some of that up. But if it's a transparent application process, and if Fairfax decides to adopt a process where they're reviewing applicants and deciding who they want before requiring them to get property and spend a whole bunch of money on property, that might also help to reduce the likelihood of lawsuits.
Thank you.
I would just add one final thought to that, and that is in all of the states that have gone through some form of medical or recreational adult use, one of the common things I would say I hear from every single one of them is that this is an adaptive process. There is no best case scenario. Everybody is constantly iterating what their rules are and shaping it to conform to their community as best as they can. And so I think if you end up holding out for that perfect, to date there really is no perfect. It's just being committed to it and dedicated to refining it so it meets the needs of your community.
This has to do with intoxication and impairment. The questioner noted that standards still need to be developed and adopted. And if you could comment on what this involves and kind of the challenges we face before we achieve that and in order to achieve that.
I touch on that just a little bit. I don't have full knowledge, but I do know that the University of San Diego, I think it's UC San Diego, received a bulk of the grant money associated with developing DUI standards, and it's something that the state is very committed to, and they have designated a significant amount of the excise or the value-added 15% tax that you're going to be paying on cannabis to go towards that. So it's something that I think is a priority for the state to have figured out to give law enforcement guidance. There's also going to be grants that are going to be given to communities that have cannabis allowances. So if you prohibit cannabis in your community, you're not going to be eligible for some of the state grants that could be coming through with the excise tax. So that's something to think about from the if you do or if you don't. It doesn't stop your police force from having to deal with some of these things, and yet you could cut off a very valuable revenue source. And so those are just some things to think about going forward.
I mean, that's the nuances around the enforcement and developing a tool where you can actually measure THC levels in real time, like you have with alcohol, which is in development. You know, from a public health standpoint, I think just a common understanding that in fact THC intoxication does impair driving, I think is an important message for all of us to share because we know that to be true.
Thank you. How is recreational cannabis legalization going to affect medical cannabis access? I guess we talk about the differences in this new landscape where you
Yeah,
have recreation.
I think we'll see a lot more products available, so it will increase access because in any regulated market, it's safer to invest in creating more diverse products and safer products. And so we'll see a lot more of all sorts of products in California that will benefit the medical market. I think that, yeah, we'll see a lot more, and what we see will all be required to be lab tested. And so certainly anything that is in the medical market will probably be safer than it is today. A lot of folks do testing, but it's voluntary, and a lot of folks, the testing requirements don't just say you have to lab test stuff. It's very specific about pulling from different parts of the plant and testing. You know, it really tries to prevent anybody from getting around the regs. And so I think we'll see safer products in the market than have been in the market in past years.
And related to that, in terms of cannabis and separating out the high CBD, non-psychoactive ingredients in various products, and I believe you're already involved in the manufacturing of some of that, but the further development and testing of that?
Yeah, that's tough. You know, until a few years ago, we weren't seeing people that were separating THC from CBD. There's a lot of CBD that's been on the market for a long time, and often people will, there's a conversation about, is it from cannabis or is it from hemp? And when people say hemp, really they mean industrial hemp slurry. And so China is the largest producer in the world. There are a number of other countries that are big producers of industrial hemp, but those are used for textiles. And after it's used for textiles, they'll take what's left over, the industrial hemp slurry, and throw that through some extraction machine, possibly CO2, to get the CBD. That CBD then will have whatever was in the industrial hemp slurry. And because that wasn't grown for human consumption, it was grown for textile production, we'll often see heavy metals and all sorts of pesticides in there. So now when people are asking if it's coming from cannabis or from hemp, that's sort of a tricky question because most folks don't have the technology to separate THC from CBD yet. That's not commonly available in the marketplace, although some people do have that. So most CBD that we see is from hemp, technically, but hemp is cannabis that has less than, and it depends on the state. Some states define hemp as cannabis with less than 1% THC. Some states define hemp as cannabis with less than 0.5% THC. And so now hemp, there's more and more US grown hemp that's grown in accordance with organic standards, and CBD is being extracted from that. And so, there's no difference in the CBD itself, whether it's coming from hemp or from cannabis. The only difference is the amount is, how concentrated it is in the plant, so how much plant matter they have to use to extract it. So, yeah, that's a little bit about CBD. I don't know if I got to the point of the question.
And one perspective on that is the studies that I cited where psychoactive or mental health issues are associated with cannabis use really point to the THC as the causative agent for that particular harm. And I think there's a lot of promise in actually potentially that extraction process where you actually get the cannabinoids isolated from the THC, because the THC seems to be the offending agent, especially with regards to the development of psychosis.
Well, and the challenge is CBD is illegal, but it's at the Whole Foods at Good Earth, you'll see hemp milk and other hemp products. And so for a long time, we were importing hemp from other places or importing CBD from hemp that was grown internationally. And so, there's been this big debate about is CBD legal, and oftentimes CBD from certified hemp has been considered legal, but CBD that's in this new regulatory market in 2018, in the channel as they define it, will be regulated as THC will be. So, if there are, the same company cannot sell to a permitted, to a permit holder or a licensee and to a non-licensee. So for example, if a manufacturer makes a CBD-only product, and that CBD-only product, and that company is licensed and selling to dispensaries, that company cannot sell to the local health food store as well, because they the language is not specific, but it says they can't sell to any, a licensee cannot sell to entities that are not licensed. And so it sort of separates those two things, which is interesting and unique, and we haven't seen that yet.
Thank you. I'm going to wrap up with some questions that are probably more addressed to Fairfax staff than the panelists. First is, what are the regulations or restrictions on cannabis use on the street? And they're the same as those for smoking, so distanced from entries and things of that nature. What are the Fairfax rules on home cultivation for adult use? As of January 1st, you would be allowed to grow 6 plants indoors or outdoors. If the community voted 3-1 to legalize recreational marijuana, what justification for officials to prohibit or unconscionably burden or delay implementation of recreational cannabis sales? Clearly, that's a question to be directed at your city leaders. How do we know people who voted for cannabis want businesses in our town? And this loops back to my comment earlier in the evening. We have an online survey, and we have over 135 registered respondents and close to 300 or over 300 people total. And that is providing a pretty good sample size for what people think in Fairfax and indeed outside Fairfax. So if you haven't done so, if friends of yours haven't done so, I strongly encourage you to let your voice be heard. My understanding is that the County of Marin denied all applications for permits and dispensaries. How are we able to bypass county laws? Simple answer is each jurisdiction is a separate jurisdiction. In other words, county rules don't apply in Fairfax. They do not in this case, so we are free to adopt our own regulations. And with that, I would like to thank all our truly superb speakers tonight for taking time out. And the people who took the time to come and listen to these presentations, and also people who viewed this online. I can assure you this discussion is only beginning and will be continuing as we go forward. Thank you very much.